My name is Sophie Morse, and I am a Philip R. Lee postdoctoral fellow at the Institute for Health Policy Studies. I pursued this fellowship because I wanted mentorship in the area of women's health policy from scholars with different disciplinary backgrounds. My work falls at the intersection of health policy, gender-based violence, and sexual and reproductive health. While I was finishing my PhD in public policy, focused on the implementation of policies that address violence against women in Mexico, I realized that I wanted to build on the health system and health service focused work that I had been doing to look more at how health policies and experiences of violence impact women's and adolescent girls' lives and sexual and reproductive health outcomes. IHPS is the ideal place to grow in this direction because I have mentors such as doctors Mara Decker and Cynthia Harper, who are both experts in sexual and reproductive health and who work in the areas of adolescent health and access to contraceptive care. This fellowship also affords me the opportunity to publish my dissertation papers and to think creatively about how to build my career while also applying for early career funding from NIH and other sources. I love that I can workshop ideas with both social scientists and clinicians at different stages of their careers. In my research, I think about health policy in two ways. First, about how healthcare workers understand their responsibilities and provide care, and second, about why women choose to seek care or not. Both the actions of healthcare workers and patients ultimately impact patient outcomes, as the moment when a person who's experienced violence or needs reproductive health care is a critical one. Mainly, I think about these two facets of health policy as related to gender-based violence and sexual and reproductive health. And currently, I'm working on a project looking at whether young women in California and Texas who have experienced intimate partner violence and reproductive coercion face delays in accessing contraceptive care. With the current landscape of highly restrictive reproductive rights, it is increasingly important that we understand barriers to reproductive health care and reproductive autonomy using a health equity lens.